So, my dears, today we are going to look into the endocrine system. Okay, fine. Here in this endocrine system, we'll be just having a glance about what are the endocrine hormones and so on. In depth, all into the details of the diseases we dealt in other session. But here we'll just emphasize on what are the endocrine hormones. Okay, we are just going to focus on the hormones. So, if you have a better idea of what are the endocrine hormones, you will be able to understand the disease conditions. So, I just want you to study this endocrine system from the class itself. Clear. So by today's class, we are completing the medical surgical nursing. So now it's your responsibility to study by looking into the burner, study by looking into the recorded classes which have been uploaded, study by looking into the PDFs which have been uploaded into the session, into the application, right? So the endocrine system, the endocrine glands. What do you mean endocrine gland? An endocrine gland are those glands which doesn't have any duct. It will release its hormones directly into the pool of blood. And what are exocrine glands? Exocrine glands are those glands which are having duct, salivary glands, sweat glands, a tear gland. All those glands are having duct which stores, like gallbladder is also a gland which stores it, which stores the bile. Right. So endocrine glands are those glands which doesn't have any sort of duct. They'll completely release the hormones directly into the blood. And there are some another third type of gland which is known as a mixed gland. Pancreas is an example for that. Pancreas is having both the properties of an endocrine gland as well as an exocrine gland. Fine. So first one. We are moving into the endocrine glands. Right? So first endocrine gland is the hypothalamus. So where is you can see the hypothalamus just beneath the thalamus. We have an hypothalamus. Hypothalamus controls the pituitary gland. Now, what are the hormones of the hypothalamus? There are specifically two hormones in the hypothalamus or an endocrine orchestra. Right. So those are oxytocin as well as vasopressin. So these are the two hormones. So if just take the screenshots of all these things, that's why I have made it so specific for you to understand, and just for the understanding of your these conditions. So the hormone oxytocin as well as the vasopressin. Oxytocin is known as a love hormone, and vasopressin or the ADH antidiuretic hormone. Right. The oxytocin, what is the function of the oxytocin? It helps in the contraction, like uterine contraction, all internal organ contraction. It helps with the smooth muscle contractions, and so that is the main function of the oxytocin. What will happen if it is excessively secreted? BPH. What is BPH? Benign prostate hyperplasia. Okay. So what is the deficiency caused? Oxytocin deficiency will cause to autistic diseases. Clear. Now, second condition is vasopressin. So it is an ADH regulatory, the ADH antidiuretic hormone. It regulates the water balance in the body. It presses, as the name itself indicates, it presses the release of urine, or it presses the release of water through the urine. And what will be if it is increasingly produced? If it is increasingly produced, the water won't be excreted through the body. It will all retain in the body, so which leads to an edema. Okay. So edema, where you can see the edema? Edema can be seen in the extracellular fluid, the interstitial space. Okay, kindly note the edema will be seen in the interstitial space. Now, as a deficiency, it may leads to diabetes insipidus. Okay, the deficiency of ADH will leads to diabetes insipidus, whereby the body won't be able to regulate the water balances. Thus, the body will excrete a lot of water through the urine. Those are its two hormones, oxytocin as well as the vasopressin. Clear. Now, see this one. What is this? This is a normal. This is a normal prostate. This is a normal prostate size. Okay. This is an enlarged prostate, which is known as BPH, benign prostate hyperplasia. Now, we shall look into the disease condition little more further. The BPH. See, in the BPH, just a minute. Sorry, guys. The BPH, benign prostate hyperplasia. Uh, Sorry for the disturbance. The benign prostate hyperplasia. Benign prostate hyperplasia has been divided into stage 1, stage 2, stage 3, and stage 4. Okay. So what is BPH? It's a cancerous growth, right? It's a benign cancerous growth. This prostate gland will increase its size depending upon that depending upon that we have classified it to stage 1, stage 2, stage 3, and stage 4. So what is the drug that we will give you for the BPH? Anybody? See, in case of prostate, this enlargement in the this prostate glands, it's a smooth muscle. So we'll give a smooth muscle relaxant, that is Urimax. Okay, Urimax 0.4 mg. So while we'll be giving the Urimax, while we'll giving the Urimax 4.4 mg, it will relax the smooth muscles and it will facilitate the output of the urine. That is the main function of the Urimax. In case of third BPH or fourth stage BPH, in third or the fourth stage BPH, we have to go for surgery. What is the surgery? The surgery is TURP, transurethral resection of the prostate, and we have explained it, right? Guys, give me just 2 minutes. Okay. So we were talking about the benign prostate hyperplasia, right? So we'll be doing the TURP surgery, transurethral resection of the prostate will be done. And what are the main management? What are the main signs and symptoms of this BPH? BPH, since it is constricting the urethral opening, the urinary retention. How to understand that? So when there is a urinary retention, there is an increased abdominal pain. In the later stages, okay, then there will be a frequent and a recurrent UTIs will be the clear. So those are the main clinical symptoms and how you have to manage, like Urimax and all those things. Finally, if it is increased, we can go for the surgery, right? So that is BPH, benign prostate hyperplasia. See, this is an autistic condition. So autism, all these autism and these things will be dealt in the pediatric session. Edema. See, this is a pitting edema. We can classify the pitting edema as +1 pitting edema, +2 pitting edema, +3, or we can classify plus, 3 plus, again 4 plus will be there. That is the stage of the pitting edema. And what is the main difference between pitting edema and non-pitting edema? In case of pitting edema, the when we punch onto the edema site, it will be pitted like there will be pit formation. Okay, the recoiling will be very slow. That is a condition which is known as a pitting edema. And what was non-pitting edema? Soon as we take the hand, there will be pitting. Obviously, there will be pitting. So soon as we take our hand, it will recoil. So that is the main difference between pitting edema and non-pitting edema. Once again, the in case of non-pitting edema, it will be recoiling will be very fast. No. Second is the pituitary gland. What happens in your pituitary gland? Okay. What happens in your pituitary gland? So we have pituitary glands, like two types of pituitary glands. The adenohypophysis and neurohypophysis. Like what is adenohypophysis? It is your anterior pituitary, and we have a posterior pituitary, right? Now we shall see one by one. We are now seeing the anterior pituitaries. So all the hormones released by the posterior pituitaries are of hypothalamic hormones. Okay, oxytocin as well as the vasopressin. Those are the two hormones secreted. It's I have to say it is released. Mm, Clear. It is secreted by the hypothalamus and the pituitary is releasing it. No, anterior pituitary as well as the posterior pituitary. And what is anterior pituitary? Anterior pituitary hormones. First one is ACTH, adrenocorticotropic hormone, ACTH. So what is the function of ACTH? It stimulates the cortisol. Okay, so where we can see the cortisol, it is in the adrenocorticotropic hormone, which is there in the adrenal glands. Okay, it stimulates the cortical stimulation. Okay, it stimulates the production of the cortisol. So when the cortisol is increasingly produced, it leads to Cushing syndrome or Cushing's disease. Whereas if it is decreasingly produced, it will leads to adrenal insufficiency. Kindly note these conditions. Usually asked for in pediatrics, Cushing's disease and adrenal insufficiency. When these hormones are decreased, excessive, there is an excessive production of this ACTH, which leads to Cushing's disease. Whereas if it is an adrenal insufficiency, it is a deficiency of the ACTH hormone. Second one is a TSH, the thyroid stimulating hormone. So what is a thyroid stimulating hormone? The thyroid stimulating hormone will leads to for both it leads to what? Stimulation of the thyroid glands. Right. So that is a TSH hormone. It leads to the thyroid release of the thyroid hormone secretions. So what happens when the TSH is when what happens when the TSH is excessively produced? It leads to hypothyroidism or a Graves disease. You know the Graves disease, the eyes will be protruded, bulged, and all those things. When the thyroid hormones are affected, it will affect the entire metabolism of the body. Okay, so there will be Graves disease if it is excessively, if the TSH is excessively secreted, it leads to Graves disease. And what about the definition? It leads to cretinism or the hypothyroidism. It leads to hypothyroidism. My days, I'm getting a call from your institution. Just a minute. So, coming back to the pituitary glands, in the pituitary gland, we have the thyroid stimulating hormone, which, if excessively stimulated, will leads to a Graves disease or a hypothyroidism, or a deficiency will leads to a hypothyroidism or a cretinism. Right. Third one is a growth hormone. Third one is a growth hormone. So, growth hormone, excessive condition. It cases gigantism and acromegaly. So, what is the difference between this gigantism and acromegaly? See, growth hormone. So, when we grow, we'll grow up to a certain age, right? So, what do you mean by this up to a certain age? Up to a certain age means a person will continuously grow before the fusion of its epiphyseal plate. Let me explain it again. So, suppose this is your bone. Okay, at this particular point of a bone, here is the epiphyseal plate. To be precise, so these are the epiphyseal plate. Fine. So this portion of your bone tends to elongate or tends to grow. Okay. At the age of 17, 18, 19, up to 22, 25, up to in this condition, these areas will grow. So after the age of 20, 22, there will be fusion of this epiphyseal plate, which means this bone doesn't grow further. Okay. That is fusion of epiphyseal plate. Clear? Now, if the growth hormone is secreted before the fusion of epiphyseal plate, which means at the age of 14, 15, 16, 17, 18, at this point, if your growth hormones are increasingly produced, it will lead to a gigantism condition, which means you will grow in height. Like you have you seen the 7-inch tall person, 8 inch tall, 7 feet tall person, 8 feet tall person, right? The height of the person, the length of the person increases. That's because it is before the growth hormones are secreted before the fusion of the epiphyseal plate, right? And the second condition, acromegaly. And what do you mean by acromegaly? So the acromegaly means the growth hormones will be secreted after the fusion of the epiphyseal plate. Clear? the growth hormone will secrete after the fusion of epiphyseal plates. For example, after 25 years, 20, 26, 30, in that condition, the epiphyseal plates can be what? The growth hormone will be secreted. The growth hormone will be secreted. So that is the epiphyseal plates. Clear? Now, that is the excessive production of growth hormone. Second one is deficiency. If the growth hormone is deficiently produced, it will leads to a condition known as dwarfism. So what is dwarfism? The person will decrease the height. That is dwarfism. Next, fourth one is prolactin, the hormone prolactin. Prolactin helps in the production of breast milk. Okay. Now, what happens if the excessive prolactin is produced? In men, it leads to milking in men as well as in women. Okay. And a deficiency, it leads to a hypoprolactinemia condition, whereby the females, the mother, the feeding mother won't be able to produce the number of the normal level of what breast milk. Clear. Next is FSH, follicle stimulating hormone. FSH is it should be there for male as well as for female. The breast, for the upliftment of the sterility, with the infertility areas. So the follicle stimulating hormone will act on men to produce the sperms, whereas it act on follicles or the estrogen, on ovaries to produce estrogen. Okay. So both in both conditions, if SHS is increasingly produced or deficiently produced, it leads to infertility condition. Okay. So next is luteinizing hormone. What is luteinizing hormone? LH. It stimulates the ovary in the female as well as the testosterone in male. Okay. So this FSH and LH is very much important if you are dealing with IVF procedures. So the FSH as well as the LH will be specifically asked if the question is coming from gynec IVF. Okay. So the LH, if the luteinizing hormone is excessively produced, there will be increased sexual drive. Whereas if it is decreasedly produced, it leads to infertility. Why? The testosterone is affected. Next is MSH, melanocytic stimulating hormone. It leads to pigmentation of the skin. What happens if it is excessively produced? It leads to increased pigmentation of the skin or increased color of the skin. Whereas when it is deficiently produced, it leads to decreased color. It depends upon the color. Okay. Now you can see the moon phase. Clear. This is the moon phase, which you can see in an adrenal insufficiency. Clear. Kindly understand this. In adrenal insufficiency leads to moon phase. Now, in hyperthyroidism, there will be Graves' disease. What is Graves' disease? There is goiter. It is simply the goiter. Okay, goiter. It is due to the TSH problems. So, exophthalmos, the xerophthalmia will be the myxedema. See, a condition known as myxedema. And if it is further affected, it leads to myxedema coma condition. See, multinodular goiters will be the okay hyperthyroidism or the Graves' disease. Exophthalmic goiter. Okay, this is Graves' disease. See, the Graves' disease. Now, this is a condition known as gigantism. The height of the person increases. See, this is the condition known as acromegaly. So I believe this you will be very familiar this with this person, right? Khalid. So see the these structures. See the bones. Okay. See what happens in case of acromegaly is that since there is an fusion of your epiphyseal plate. Okay. Since your epiphyseal plate have been fused, the bone can't grow at these epiphyseal areas. Okay. The bone can't grow at these epiphyseal area. In that condition, what happens? It will focus on the short bones, like or the fingers on your knee, the bones on your fingers, your cheek bones, your forehead bones, your nasal bone. So all these small area bones will be focused and the enlargement of these bone occur. So that condition is known as an acromegaly. No long bones are affected. Kindly understand, in case of acromegaly, no long bones are affected. Now, this is a condition known as dwarfism. Height of the person decreases. See, hyperpigmentation in case of melanocytic stimulating hormones. Now, third one, the pineal gland. Okay, so we were looking into the the pituitary gland, which have completed. Next gland is your pineal gland. So the pineal gland will help. The pe the pineal gland will help you to produce a melatonin. So the melatonin is a sleep hormone. Okay. So what happens if melatonin is decreasingly secreted? There won't be much sleep at night. See, there is a saying that if you are, it is not a saying, it's a studies postulating that study postulate that because if we are using mobile phones for a very long time, especially during the night, it will decrease the production of your melatonin hormone. That's why we won't be able to, you won't be able to what you won't be able to sleep at night. No, thyroid gland. Thyroid gland, which is controlled by the TSH produced by your hypothalamus, your pituitary, right? Now, the thyroid glands, we have T3 as well as T4. Okay. T3, triiodothyroxine and thyroxine. T3 and T4. Kindly note that name. Triiodothyroxine. The questions won't come like 3T, 3, 4. The questions will be coming like triiodothyroxine and the thyroxine. So those are the names of the hormones produced by the thyroid gland. So, see, both things, T3 as well as T4, both function for the metabolism of the body. Okay. Now, T3, kindly note the condition. Again, these diseases are asked on a very much not a scales. T3 will lead to Plummer's disease, whereas the deficiency will lead to Hashimoto's thyroiditis. Okay, it is otherwise known as Hashimoto's goiter. Excessive T3 will lead to a Plummer's disease, and the deficiency will lead to a Hashimoto's thyroiditis. See, toxic nodular goiters, the Hashimoto's thyroiditis. See, the Plummer's disease is for a longer duration. It is affecting the middle-aged. Okay, so no, usually the nodules will be inactive, but there may be a chance that it may go for a cancerous growth. Fine. Next, fifth one is the parathyroid gland. So there are two hormones for the parathyroid gland: parathormone as well as the calcitonin. See, the parathormone as well as the calcitonin both function on the calcium. Okay. So what will this parathormone and calcitonin does? What does this parathormone calcitonin? Calcitonin, the function of calcitonin. See, suppose this is blood, okay, and we are having calcium in the blood. What will the calcitonin do? The calcitonin will take the blood from the, it will take the calcium from the blood, and it will deposit it in the bone. Okay, that is the function of the calcitonin. And what is the function of parathormone? It will take calcium from the bone and it will deposit it inside the blood. That is the function of the parathormone. Okay, so that is their function. Now, excessive parathormone will leads to hyperparathyroidism, and deficiency will leads to hypoparathyroidism. Okay, when the calcitonin is decreased, which leads to hypocalcemia, right? So, which leads to tetany and osteopenia. When it is excess, it leads to bone cancer. Okay. So that is about parathyroid gland. Two hormones, parathormone as well as the calcitonin hormone. Now this is the tetany. This is yesterday I have asked you to check what is the chopstick sign. I hope you all have checked it, right? So we can elicit the tetany by doing the chopstick sign. See what I have just explained. That is this thing. Okay. This is a calcitonin as well as a parathormone function. See, calcitonin will take the calcium from the blood and deposit it in the in the bones, whereas the parathormone reversely. Next is the thymus gland. See, this is a thyroid gland. Okay, this is the thyroid gland, and here we have the thymus gland. So thymus, usually this thymus is activated in children. Okay. When you become adult, the functions of the thymus gland decreases. What is the function of the thymus gland? It boosts the immune system, right? So in an adult, the immune system is controlled by the lymph nodes as well as your other bone marrows. So the functions of the thymus gland decreases. The thymosin is the hormone released by your thymus gland, which acts on this immune response and boosts the immune system. Clear. Now, the seventh one is your suprarenal gland or your adrenal gland. Okay. Suprarenal means it is on the renal gland. Okay, it's just above the renal gland. So it is known as a suprarenal gland or adrenal gland. Now, the adrenal gland is having a covering. Okay. Actually, it is a cortex as well as a medulla. Adrenal cortex as well as adrenal medulla. We have adrenal cortex as well as adrenal medulla. Now, the adrenal cortex is having coverings like zona glomerulosa, zona fasciculata, and zona reticularis. Those are the three layers of adrenal cortex. Kindly write it down, guys. Zona glomerulosa, zona fasciculata, as well as zona reticularis. These are the three layers of the adrenal cortex. And adrenal cortex produces mineralocorticoids as well as glucocorticoids. Okay. Here in the medulla, it releases the catecholamines, whereas the cortex releases aldosterone and other adrenal glands. Like we'll see this one. See the cortex as well as the medulla. We have cortex and medulla. The medulla produces adrenaline as well as the noradrenaline. Clear. The medulla produces adrenaline as well as the noradrenaline, which are the catecholamines. Okay. It reduces the adrenaline as well as the noradrenaline. Now coming into the cortex, the outer cortex. We have three layers, right? We have glomerulus, fasciculata, and reticularis. Now, this cortex is again divided into mineralocorticoids, glucocorticoids, and gonodocorticoids. This is important. Okay, if you don't understand or if you don't study the hormone, the coverings of like zonas, it won't affect you. But this one you have to study that. Like mineralocorticoids. The mineralocorticoids will produce aldosterone, which helps in the renin, angiotensin, aldosterone mechanisms. Right. Second one is a glucocorticoids. This glucocorticoids will act on, it will produce the cortisol. Okay, hydrocortisone. It will produce the cortisol. Now, gonodocorticoid. See, name itself indicates if it is gonads, it should have an effect on testosterone as well as estrogen. So the testosterone is in the testosterone and estrogen. Okay. So the gonodocorticoids, the mineralocorticoids, as well as the glucocorticoids. Those are the hormones produced by the adrenal gland or the suprarenal gland. Clear? Next one, the functions. The hormones, aldosterone, will regulate the pressure. You know the renin, angiotensin, aldosterone mechanism. So hyperaldosteronism as well as the hypoaldosteronism. Those are the two conditions. See, the clinical manifestations as well as other signs and symptoms. It is not possible for to study each and every condition. That's why what I am saying. Just understand the disease condition. What is a disease condition? Here, in the aldosterone, the hormone aldosterone, it regulates the blood pressure. What happens if the aldosterone is increasingly produced? A condition known as hyperaldosteronism, right? So when these aldosterones are increasingly produced, it will affect the blood pressure. The blood pressure will be increased, right? It's a simple mechanism. The blood pressure will be increased. So when the blood pressure will be increased, what happens to the patient? It may affect its heart. It may leads to hemorrhage, right? It may leads to a CVA condition, or the heart will be increasingly beating. There will be a cardiomegaly due to the increased pressure in the in the ventricles. So hypoaldosteronism. So when there is a hypoaldosteronism, the BP regulation will be decreased. Okay, the patient will be always having a hypotension. Clear. And what other conditions? The activities of the patient will be affected. The patient will be drowsy. Likewise. Now, cortisol. The cortisol, what is the see? If you have an allergic response, or if the patient is having a severe breathing difficulty, what will you give? We will give hydrocortisone injection, right? Why we have giving the hydrocortisone injection? It is not to relieve the breathing difficulty, but to suppress this immune system. When your allergic immune system will be suppressed, automatically your breathing difficulty will be suppressed. Like if you have an reaction, if if a bee bites you and you're having an allergic response, I will. Chlorpheniramine malate. Along with the chlorpheniramine malate, they'll give the hydrocortisone injection to you. So it will suppress the immune system. Okay. So cortisol, what happens if these cortisol are increasingly produced? It leads to a condition known as Cushing syndrome, and the deficiency will leads to Addison's disease. Fine. Then sex hormones. Which are the sex hormones? Those are testosterone, estrogen, as well as the progesterone. Okay, so the any excess and deficiency leads to infertility or sterility. No, we have adrenaline, we have adrenaline as well as a noradrenaline secretions. Adrenaline and noradrenaline prepare to the noradrenaline will help you to prepare the body for fight or flight response, whereas the adrenaline is the fight and flight response. You, you are very familiar with this adrenaline and noradrenaline, right? Fight or flight response. We have studied it in the sympathetic and parasympathetic nervous system, the autonomous nervous system. So the adrenaline also, the adrenaline will be rushed in case of sympathetic as well as in the parasympathetic nervous system. Fine. See, there is no condition where there is an excess or a deficiency because these adrenaline as well as noradrenaline is a quick response hormone, so it will be produced in that condition. If the conditions where these not are produced, where there is a severe adrenal insufficiencies or the suprarenal gland deficiencies. Okay. In that manner also, it is produced by the medulla. So the hormones which may affect is a cortical hormones, whereas the medullary hormones are not further affected. No, the liver and the pancreas. See, this is where the pancreas is. In endocrine gland, we don't have liver, but we have the pancreas. Right. So the islands of Langerhans. It is like it is the islands of Langerhans. So in the islands of Langerhans, we have the alpha cells. We have explained it, right? In the islands of Langerhans, we have alpha cells as well as beta cells. The alpha cells produce glucagon. Okay, the alpha cells produce glucagon, whereas the beta cells produce insulin. And what is the function of insulin? It will decrease the blood sugar level. And what is the function of glucagon? It will increase the blood sugar level. Okay, like this one. This is how the normal range of the glucose is maintained in the blood. The insulin will decrease the blood glucose level, whereas a glucagon will increase the blood glucose level. So, if there is a deficiency of something, what will be the condition? If there is an excessive condition, what will be the condition? Now, gonads. We have gonads. Male gonads as well as a female gonad. So the gonads means it is the testis in males, whereas the ovary in case of females. The testis produces testosterone as well as the ovary produces estrogen, right? So those are the hormones which is produced by your gonads. See, the testosterones are mainly produced by the Leydig cells. And what are the functions? The testosterone is acting on the secondary sexual characteristics as well as the primary one, like erection of the penis, the facial hormones, sorry, the facial hairs, the pubic hairs, then change in the sound, then what? Masculine natures, all these are focused by these testosterone hormones. Whereas in case of ovary, what is the function? When the ovary, which is produced by granular cells of the ovarian follicles, okay, it is Leydig cells by the testosterone for the testosterone and the granular cells for the ovaries. Okay, for the ovarian follicles. Okay, so when these ovaries produces testosterone, it will decrease it will decrease the what you can see the face, the wrinkles will be decreased, or you can simply say if a lady is having a menses, her face of her face, her youth is protected. But when the menstruation cycle is lost, if there is no menses, when the lady attained a menopause, when the lady attains a menopause, there starts the wrinkles and so on. Okay. Then we have another some extra layers or an extra gland which is known as a temporary endocrine gland. Corpus luteum is an example for that. So what is a corpus luteum? I have again explained. When an egg is produced from the ovary, the covering of the egg, that is known as a Graafian follicle, right? That is known as a Graafian follicle. So when the egg fertilizes, this graphene follicles will be converted into corpus luteum, which is inside the ovary itself. Okay. This corpus luteum, which act as a temporary gland until this function is resumed by the placenta. Okay, and the corpus luteum. What are the hormones of corpus luteum? What are the hormones of corpus luteum? It is the relaxin as well as progesterone. Okay, so when the placenta is activated or when the placenta forms, the functions of the corpus luteum is taken by the placenta, and this placenta produces human HCG. What is that? Is human chorionic gonadotrophin (HCG). So this HCG will help in the what for like the pregnancy kit. It will helps in the understanding of your pregnancy kit, right? In the urine, the HCG hormone will be increased, so that HCG is detected by your urine when you do your urine pregnancy test. Okay, your UPT will understand or identify the human HCG hormone. And second one is human placental lactation (HPL), which is helping for the maintenance of your placenta. Okay, so these were the hormones that were secreted by your endocrine glands. So are you having any doubt in these endocrine glands? Kindly